I want to talk to you about something that just happened to me that perfectly describes why I really dislike, perhaps hate, when doctors do this.
Have you ever had trouble talking to a doctor? Hi, I'm Dr. Eric Westman, and welcome back to my channel where I review and debunk nutritional misinformation online. I've learned about and following a practicing doctor who is a YouTube influencer. That's not a common thing these days. And Dr. Sunil Dand, thank you for sending this video for me to react to. He's furious. The video is called "I'm So Bloody Furious" with doctors right now. Let's see what Dr. Dand has to say, and of course be sure to wait till the end to hear my final thoughts. Before we get started on today's video, I wanted to personally invite you to join me in the next 3-week Keto Made Simple program, which is opening for enrollment on May 1st. I call it Keto Made Simple because it's exactly that. You don't have to calculate macros, you don't need to measure ketones, you don't have to weigh and measure your food, and you don't need to do any fasting. You'll learn the exact same proven method that I use with my patients. This is the last time the program will include 3 weeks of support with me and my team, so join the waitlist now to guarantee your spot. See the link in the description.
I want to talk to you about something that just happened to me with a family member that perfectly describes why I really dislike, perhaps hate is too strong a word, but maybe I should say actually hate it when doctors do this, when they act like this. Because I've encountered this far too often personally, and I'm sure it happens to thousands upon thousands of people all the time. And it really makes me wonder, it makes me think, with any doctor, where is your humanity? Do you understand how important communication is in the job that you do? How can you completely forget that? Okay, so I have a cousin who has had a few health conditions recently. And she recently started having some fairly alarming symptoms. And she was going back and forth to the doctor and wasn't really getting anywhere. And her symptoms kind of escalated. And she called me up and said, look, this is happening now. And I said, well, this sounds pretty concerning given your history. So I think you really should go and see the doctor. Maybe you even need to go to the hospital. And when you're in with the doctor, I would like you to get me on the phone. Let me hear what's being said, and the doctor can talk to me as well.
Well, so any doctor knows the difficulty and at times awkwardness of having family members having trouble and asking you for comments and even advice about what's going on. I've learned to just say that I'm off duty. I don't really want to talk about the keto diet or the low-carb diet when people tell me how great it is or when I'm trying to do something else. But I've had similar instances where I just wonder where the humanity is with doctors. I am often struck how little time doctors have these days to handle things, but still you want to be able to communicate. I am totally in agreement with Dr. Dan's observation that communication is a very important element of successful practitioner practice, including doctors.
So I texted about half an hour after the expected appointment time and I said, well, has the appointment happened yet? What happened? Why didn't I get a call? And she said to me that, oh yes, she's had the appointment and she told her doctor, try to get me on the phone. Listen to this part of it. The doctor had absolutely zero interest. She explained, my cousin's a doctor, he's quite concerned. Is it okay if we just have him on speakerphone as well? Obviously, the doctor didn't know who I was, that I'm online or anything. No name was mentioned. She's got a different surname to me. And the doctor steadfastly refused. And the report I got was basically the doctor kind of berated her and said, you are a fully grown adult. You don't need anyone else to hear this. You can have a word with your cousin afterwards. I get this kind of feedback all the time about absolutely dismal communication from doctors who don't think that's their job to communicate. I mean, how hard would it have been?
Yeah, well, if you think about it, I suppose from the doctor's standpoint, so the doctor says, no, I don't want to talk to your cousin who's a doctor while you're in the appointment. It would take more time. The other doctor would undoubtedly, the other family member or doctor would have more questions, and it would take more time, maybe. So I have to assume that's sort of the underlying thinking when she was berated as, you can think for yourself, you're an adult. I've learned long ago, and doctors have different styles, that I'm an advisor for your health. You're not going to necessarily take my decree of advice, but when you put it in that way, the way I communicate it is really, really important, because I know that you may or may not take the advice. And so, speaking from the humanities side, from a caring position, and explaining things, taking the time to explain, well, there you have it again. If you're not given the time as a doctor, often you're making it happen as fast as you can, need to get on to the next patient, you're running behind. Those pressures are always there. But it's good to hear, so Dr. Don wouldn't have done that himself, which is a nice characteristic. So that I do that too. If a family member wants to come in or be on the phone, and I just say, well, I only have this much time, and everyone understands that, then I'm fine with that. In fact, I like when people come in with questions written out, even with their history already typed up, although I know a lot of doctors hate that. Have you ever gone in with your litany of questions? Or, in my prior life, where I had a certain number of people to have to see, and I couldn't handle everything, it would be triaging the most important things. Fortunately, I'm in a practice where I can take the time, typically. Not always, but typically. So, yeah, it's hard for me to imagine Dr. Don to be angry about anything. He's so mild-mannered, but I share the same frustration with the way other doctors communicate.
I mean, what is that? How could you possibly say that? Now, I would like you to tell me whether similar things have happened to you or a family member, where doctors have kind of refused to communicate and haven't considered it their duty to also speak with the family. I mean, we weren't even asking, or my cousin wasn't asking for some extra time. She was asking to simply have me on the phone as well at the same time. And I don't accept the excuse that you're very busy, you've got 30 patients to see, you're doing an important job, you're paid a decent salary for it, you're not earning minimum wage, do your frigging job.
That's well said. And, the arm's length relationship, so if you're in business, it's not up to you to know or care if the person buying your product knows how to use it, or it's called an arm's length sort of transaction. But when you get people who are vulnerable, who are children or unhealthy or having a sickness, this is called a fiduciary relationship. And the ability to communicate is a skill. You can learn it, although some people try and never do have empathy, and yet in some areas of medicine you don't want too much empathy. For a surgeon, for example, you'd rather have a steady hand than necessarily great bedside manner. Ideally, you'd have both. But the fiduciary relationship puts into the mix here, it's up to me, the one who is not ill, or the adult in the room, to behave in a way that's courteous, that is actually communicating well. I remember in the hospital, the nurses would be asked to, and you may experience this, they'll ask you to repeat back what they said, so that they can even be sure it's not just I said it to you, it's did you hear what was said, because often people are so sick they don't hear, and you want to make sure someone does register that they understand it. So yeah, a lot of doctors are just a one-way street of information. I have to assume some not only worry about spending more time, they also have certain metrics, to a certain number or percentage of people on certain medications, for example, to be following certain guidelines. These are all pressures that would take away the, well, you don't want to take my medicine? Well, That I hear a lot of people saying that the doctor berates them for not taking the medicine, which is still not acceptable either to me. We're advisors for your health, and we should be able to answer the questions to your satisfaction. So I really like his style and approach and response to this situation.
So let me know what you think about what I just told you. A doctor not only refusing to have a relative on the phone who is a physician, but also berating her, saying, "You're an adult, you can call him afterwards. You don't need me to talk to him." When she's sick, she's confused, she's worried, she's anxious, her whole family is anxious, our whole family is anxious because she does have certain medical conditions, unfortunately, which need some close surveillance, and she may end up in hospital, hopefully not.
So the situation that you may be encountering, and with my patients, they encounter this all the time, is the bias that happens because of your weight, the obesity bias and judgment. And I wonder, I hate to have you tell terrible stories. I've already heard a lot of them, but the communication is key, even when it comes to things like how much someone weighs, what they're trying to accomplish in terms of weight loss. The way of communicating to get past the stigma that even a lot of people bring into the office is something that we teach at the Obesity Medicine Association. That's a group that I'm a member of and past president of, where we teach doctors how to behave and how to handle themselves in the context of people who are heavy and trying to lose weight. So I wonder if you've experienced a doctor communicating poorly. Even it could be the eye communication or attitude that doctors have in regard to the weight or even type 2 diabetes. Most doctors aren't even mentioning that you can reverse type 2 diabetes, which is a lack of communication because of a lack of knowledge that you can actually do that. But thank you, Dr. Don, for a nice video, kind of unusual for my typical videos, but important nonetheless. Make sure that you're able to talk and communicate with your doctor. This is super important. I hope you like this. If you do be sure to like, subscribe, ring the notification bell for further content. We're looking at putting out content on Wednesdays and Fridays. If you enjoyed this video, consider joining our YouTube membership for early access and exclusive live Q&As with me. Just click the join button below or support us with a PayPal in the description.